Hi, good afternoon. My name is Danielle. I'm your social worker on your treatment team, and what my role is to, while you're in treatment, I'll be working with you on, learning ways to learning more about yourself and learning more about your addiction. I'll start off by you telling me a little bit about what brought you into treatment.
Okay, so I was using heroin, cocaine,
Mm-hmm.
canned air.
Okay. Were they those your only drug of choice? Okay. All right. And so it seems I saw from your chart that you were involuntarily committed for treatment. We are a 14-day program, and here you will be going to different classes where you can get more information about addiction. Um, are you planning to just detox, or are you planning to just participate in like the full program?
Not really sure. You said 14 days?
14 days.
This is my first time
Okay.
going to a treatment program.
Okay, so while you're here, you'll be working with a multidisciplinary team, which consists of a nurse, a psychiatrist, your social worker, myself, and maybe a recreational therapist. And we'll be working with you one-on-one outside of the groups and classes on, working with you to learn more about addiction. Would you like anybody involved in your treatment while you're here, like to come participate in our family visitation program? Or would you just want to focus, on yourself right now?
I do have 2 kids, but they're not gone with dad.
Okay.
Is it possible for them to be part?
No, unfortunately, our visitors have to be 18 and up. But if you would like their dad to participate he can do that 2 ways. He can actually come out to the facility, or he could possibly be on a conference call during your next treatment team meeting. So would you want him to be involved that way, or would you want to think about it? Okay. Okay. When did you start using?
It's been a while. Maybe 2 years ago.
2 years ago. Okay.
I recently had a friend to overdose from drug use.
Okay. So it sounds like would you like to, maybe work on maybe some grief issues while you are in treatment as well? Okay. So we do have a grief and loss group that I can also recommend you to get some work on your grief. So during those 2 years, did you have any kind of clean time or any kind of sober time?
Well, at first it just started off on the weekends.
Mm-hmm.
And then I started using it more frequently.
Okay. So, correct me if I'm wrong. So you said mostly you're using more on the weekends. So during the week, is there any time during the week that you use, or just mostly like recreational, or?
Well, at first it was just recreational,
Mm-hmm.
but now it's become every day.
Okay. Okay.
And I stopped going to see my therapist, my mental health therapist too.
Okay. So it seems like your family or someone was concerned about you and thought maybe you needed some help for your addiction.
I don't think I need help, but they don't have to have me obviously.
Okay. So you don't seem you don't know if you have a problem. You don't know just yet. You want to maybe explore the program some more and kind of get some more information. That's where it seems like where you are.
Mm-hmm.
So in treatment, we kind of like to meet you where you are. There are different stages of change. So there's preparation. Let me backtrack. There's pre-contemplation, where you just absolutely don't think you have a problem with substance abuse at all. Then there's contemplation, where you think, you're kind of on the fence about it. Maybe I have a problem, maybe not. Then there's preparation, where you have decided that you want to stop using and, make a change. There is relapse, where you just kind of feel like, I had a brief period of, sobriety, and I relapsed, and it just kind of, went and did drugs, and now I want to kind of get back to recovery. And it's just maintenance, where you just feel that, I had a slip, and I'm really wanting to, get my problem together and kind of get back into that. So which stage of change do you feel like you're in?
I think I'm kind of at the point where I'm not sure if it's a problem or not. I'm on the fence.
Okay, you're on the fence. So do you know right now on a scale of 1 to 10, your motivation of, how much how motivated are you to get help for your addiction?
What is the word? 10 is what?
10 would be, I'm more ready to make a change, and the lowest would be, you're not really sure, or you are not certain that you want or ready to make a change.
I'm at a 5.
You're at a 5, okay. So we want to work with you, and maybe work towards getting you to a 10, or working with you together as a treatment team to see what we can do to help you get towards a 10. But we're glad that you came here. This is a safe environment where you can be open with the treatment team. We encourage you to be honest and forthcoming with us so we can know how to work with you on developing a good recovery plan. And we start working on that here, so when you go out, you will already have things set in place, what you want to do next, which will be following up, maybe with doing some groups or some individual counseling and things like that. We're here for you to work with you. If you feel that the classes and things that you're taking here may not fit your needs, just let the treatment team know. We can make an adjustment to your schedule. If you feel that you want to have your family involved later, that's fine. We can just fill out the forms for visitation and have them come in. We also offer a family group that is offered on weekends. So if your families want to just come and be with other families of patients that are in treatment, they can also have that extra support. We meet as a team once a week, and then we'll see you daily, just to check in with you to see how you're doing. But you will be, most of the work that you're doing will be in groups. Sometimes we'll give you homework and things like that to do, but other than that, are you thinking about maybe doing another treatment program, or are you just planning to go back home, or what's your thoughts?
I would like to see how things go.
Okay.
Like you said something about education, just really, because I don't feel that it's really a problem. Others see it as a problem, and I don't.
Okay. Well, we'll keep, working together. What is one goal that you think that you might want, have for yourself while you're here in treatment?
To be able to see my kids.
To be able to see your kids. Okay, we do offer a parenting class, and we can also make that, if that's the area that you're interested in working on, some type of parenting, we have it as a group here. So we will work with you, on that. So that'll be one skill that'll be one goal that you will be, the treatment team will definitely focus on that. Is there anything else? You have any concerns or questions about treatment?
No, I don't. See, the parents, I don't think I'm a bad parent. Their dad just won't let me see him because he thinks I have a problem.
Okay.
Is there anything, can you tell them I have a problem?
Well, I want to be able to work with you, because you're, this is your treatment. So I don't want to get so focused, on, your spouse or your significant other. We want to just make sure that you get tools and skills that way that, your significant other can kind of see how things are working for you, or how things are working, are working well for you, and maybe start seeing some of the changes and things like that. But we can also give you information that while you're here in treatment, that you may want to share with your significant other. Okay. So when do you want to meet again? I know that you'll be attending a lot of groups and classes, but I will be meeting with you one-on-one outside of that. So when do you think you want to meet again? Soon?
As soon as possible.
Okay. So let's see, tomorrow you have a full case, you have a full day of classes. So let's say Tuesday around 1 o'clock. Okay. All right. Well, nice meeting you, Cayla.
Thank you so much.
All right. Thanks for coming to treatment.